and certainly surgery, you don't operate on you don't cut healthy things off. I mean, surgery is for removing diseased tissue. What we're talking about with this whole gender thing is completely healthy bodies.
But they're not complete. This is the argument. You're saying they're completely healthy, but they might have some psychological issues.
They've got a psychological issue, yeah.
Right, but the pro-transgender person would say, one, they don't have a psychological issue, you bigot. They're completely normal to want to transition to be a female. They were born that way, whatever. And so you're fundamentally disagreeing on the merits or the pathology of the condition, and then you start to argue about whether we should do surgery or not. But the problem is back here at the foundation. You're not in agreement.
There's nothing physiologically wrong with a human body that's, a male body or a female body. I mean, I don't think you can possibly sustain an argument that you got to think about what's happening here. You're taking, say, a completely healthy male body at age 12 or whatever. And if you just leave it alone, it will go through puberty, genitals will develop, a deep voice will develop, all those things, and those are completely physiological and normal. And normally what medicine does is we intervene when something is abnormal. So if somebody has a deficiency that prevents something normal from developing, then if there's a deficiency in growth hormone or something like that, then we administer growth hormone to help someone get to a more normal height. But in this case, what we're doing is, all the hormones that happen in puberty are normal. They're physiological, and we're going to block that, interrupt it, stop it from happening, which is not just going to stop their genitals from developing, it's going to stop their bones from maturing and their brain from maturing and those sorts of things. And we're going to interrupt that, and then what's more, we're going to give them hormones which are artificial for the opposite sex. So we're going to give them estrogen, make them grow breasts, and we are actually, and then when you start talking about the surgery, so you're surgically removing something that's completely healthy and functional, that's mutilation. We are actually, one way to look at it is you're taking a healthy person and you're medicalising them, making them sick. Some doctors who've commented on this issue have rightly said that you are actually you're creating a long-term patient. So someone who's reliant on the health system for the rest of their life, because once you sort of transition, you don't just sort of walk out and that's it, it's over. You need to keep going back, keep having the hormones, keep having all the sort of plumbing issues corrected and all that sort of thing is the way John Whitehall puts it. You got to, because the plumbing issues will keep cropping up. The thing is, when you're
fighting nature.
When you try to sort of fashion a male genitals into female genitals, or things that mimic female genitals, things don't generally just sort of heal up and then that's it. There's scarring and there's all sorts of things that will keep blocking up, and these things need to be corrected on an ongoing basis typically. And then even if they don't need to, you're going to need the hormones for the rest of your life. When you are put on estrogen long term, that isn't a risk-free thing. So estrogen, as every doctor knows, when you prescribe just the contraceptive pill to a young girl, there's a risk of actually making her have a stroke. You've got to ask a series of questions to make sure that giving estrogen to that young girl is not going to give her a stroke. I've seen it happen. I've seen a patient who had a stroke from the contraceptive pill. I've seen a patient who had a clot in the lung from the contraceptive pill. It's not a risk-free thing. Now, if you're going to give estrogen to a male for the rest of their lives, this potentially stroke-causing thing for the rest of their lives, you've turned them into a long-term patient. And you've got to be monitoring them very closely, monitoring all their sort of health markers and blood pressure and everything. Because as you get older, your risk of stroke and blood clot increases anyway. And then you keep giving them estrogen so that they can continue to be feminized. You see, this is...
So what do you say to the
We're talking about something really radical here. It's not just a once-off, we transform you into a girl, then that's it. We walk away and... Yeah.
So then what do you say to the transgender advocate who you're disagreeing with the definition when you're saying it's a normal, healthy male body that will develop through puberty normally, it's a normal process. And they're saying, well, I or my son or whatever, my patient, has a clear dysmorphia issue where they're born in the wrong body, their mind doesn't agree with their gender, whatever. So they think it's to be rectified, it needs to be fixed. And they would disagree with you from the outset. They would say it's causing harm to allow that patient to go through a normal male puberty. So by intervening, we are preventing a harm. And you're right, it is a medicalization of a normality, but that's their argument. What do you say to that?
Oh, there's a couple of things I'd say to that. One is that a principle in medical practice is you always take the path of least intervention possible. So if you've got three options, in a lot of medical problems, you've got three choices. One, sit back and do nothing and just wait and see. Two is have a pill. Three is have surgery. That's a sort of, those three choices are there for a lot of things, like say spinal problems and whatever. And you always try to do the least intervention first, because the least intervention is the least risky, the least costly. It will have the least long-term impact on the person. So it's just a sort of, you're flipping that on its head to say, oh well, the thing that we let's just jump to the heaviest intervention, which is let's biologically transform their body. You know, if there's something, you can acknowledge that there's an issue, you can acknowledge that there's a problem, but say, well, the way we approach that problem, you know, should be the gentlest touch possible. And I don't see how you can argue that the gentlest touch possible is to block their puberty, put them on hormones that will transform their body, offer them surgery, turn them into a lifelong medical patient. It just doesn't add up.
Well, the LGBT community has been very strong against some of the transgender stuff because they feel, and Douglas Murray's big on this in the UK.
Do you mean the gay and lesbian sort of...
Yeah, gays against groomers and stuff, that kind of thing. But what they're saying is, look, you've got a whole bunch of... They believe in homosexuality being fine, right? So biologically fine and whatever. So you're taking a whole bunch of boys who end up to be healthy, happy, gay men, and you're medicalizing and destroying them because they don't realize they're just gay, and you're making them into transgender women.
So if you're a lesbian, you've got to be prepared to date Caitlyn Jenner, right? so because she's a real woman.
No,
seriously.
I know they say this, except for downstairs. Let's say she's not. He's not, whatever.
Well, I don't think they care about downstairs. I think they actually say that this person identifies as a woman. They might have a penis and everything, but they identify as a woman, and so they are a woman. And if you're a lesbian, you've got to date them because they're a woman.